Thank you for having me. Elise, thank you for the nod. Glad to be here. It's been an interesting 4-year journey for me from the first time a PTSD suffering veteran came under sort of neuromodulation, which was essentially, in our particular case, individualized TMS. To put it in perspective for everybody, there is a very, very important theorem in information science, which is that if you are going to do any kind of computation, the elements that are doing the computation have to be essentially in lockstep due to some clock signal. You cannot escape this. This is sitting right there at the basis of what's called Shannon information theory, and everything that you see around you that's information theoretic, cell phones, computers, everything comes back to this. When you look at the brain, it turns out that the brain has to have this lockstep as well, and in fact it has several. But the one that actually generalizes across the whole brain in what's called the postsynaptic field is actually what's called the alpha synchrony of the brain. There's a frequency between 7 and 13 hertz, which is essentially unique to each one of us. I might have 11.3, somebody has 10.3, 10.2, 9.7. The speed simply means how fast you're clock stepping reality. The interesting thing is most baseball players are way past 12 hertz. They're in the 12 to 14 hertz range. They're extremely fast. They also have essentially no paratemporal region power, which means that they're impulsive. In one particular interview, we said, you know, we looked at the power in the paratemporal region, and it's really, really low. Tell us how impulsive you are. He goes, nobody knows this, but I bought a house on Friday and sold it on Monday. To give you an idea. So let's get straight to it. I'm on the industry side of the house. Research is not my first gig, but unfortunately I've been forced into the role because nobody wants to do the research. It's very clear from our previous experience in neuromodulation, going back 4 years and approximately 350 veterans, that this works 98% of the time. The 2% are the 2% that actually walked away from us because they decided that magic pixie fairy dust from magnets was not the way they were going to go. The other 238 that stayed, essentially we were able to do remarkable things with. Our experience mirrors what you were seeing in terms of hyperbarics. Photophobias disappear almost immediately. Sleep gets restored within 5 days. Secondary pains begin to decrease. Positive emotional return is between days 5 and 10. PCLM scores catastrophically collapse by half. And we were able to actually get this data published. Technically speaking, like I said, I'm on the industry side. We're going to be the state of Virginia is one of the few states of the union that allows the corporate practice of medicine for a variety of reasons. That's very useful to us, and therefore we're based out of there. We're going to establish a clinic there for 600 patients per year volume. Let me be frank, you cannot treat 840,000 or 850,000 veterans by this method. However, you can get enough data to suggest how you might be able to go about doing it differently and by other methods. In the meantime, certainly by this method we can get a lot of the suicidal ones through the door and get suicide off the table. We focus primarily on PTSD and chemo brain, also substance abuse. We're fantastic with mild to moderate traumatic brain injury, not severe injury. We can help a lot, but the simple truth is in severe injury you've torn circuits. In mild to moderate, you don't necessarily have torn circuits, and I can reroute around the damage, so to speak, because once the synchrony comes back into play, the brain says, why am I out of sync there? And every time I reinforce the synchrony, neurons start to grow along those pathways. It's self-reinforcing. It's very nice. Like with your experience in hyperbarics, the longer they do it, the better it is. I can get them dramatically far in 2 weeks. They're fantastic at 30 days. A small subset, about 10%, need 60 days or more, which amounts to 40 sessions underneath the magnet. It also works in autism. About half the time we can yank a child from severe autism back to essentially normality They'll still have all sorts of interesting defects because they've learned wrong, in quotation marks, but they will be extremely functional. And we've discovered that stroke-induced dementia, where the defect of the stroke is small but the dementia size is large, we can recover them dramatically. We've had, in fact, one case which was so dramatic it was scary. He came in not knowing any of his children and left talking to all of them, trying to understand why 2 years of his life had disappeared. This is our PCLM experience that we got published. I think the mean is approximately 60 there, and we were able to get it down to 30 on average. And you can see that as a general rule, we were able to push many below the so-called cutoff of 50 and significantly lower than that. The simple truth is, by day 5, they're sleeping. By day 10, their positive emotionals, their ability to interact properly has returned. And typically by 20 sessions, they said, is there any chance that I can re-enlist? No, there's no chance that you can re-enlist because, you've had, 4,000 hours of bomb explodings around you and you can't do it. But thank you for asking. Go enjoy your life right now. We've also done normative psychobatteries on them, and while I can't bring their cognition all the way back with this therapy alone, they get anywhere from a 30 to 50% jump in executive function type things, et cetera. So essentially we've restored them to a flavor of normality. And we also see this on the EEG. This is your classic guy that's had probably 3 to 5 bombs explode on him. He's not been sleeping, and he has the hypervigilance, hyperanxiety going on. That's all the high frequencies in there. Approximately 2 weeks in, we've restored his central synchrony. He's sleeping. That little blip that's on the low end is what drives the heart, and you can see that the anxiety has almost totally disrupted. So that's us in a nutshell. Typically, they present with this, wonderfully complex universe. Interestingly enough, neuromodulation helps nearly every single thing on that list, which is why they do so well. Like I said, insomnia, they sleep like children at day 5. Now, this is not to be considered a solution in isolation. I come from the age when we finally started looking at the biopsychosocial model of disease and treating the whole family and matters like that. And in fact, we have on occasion treated the spouse and children because they were suffering a flavor or variant of PTSD as well. Except they bounce back incredibly rapidly. 5 days out, they're like, I don't want to be under the magnet anymore because any issue I had has disappeared. So thank you for your time, and any questions, I'll be glad to take them.
So do you choose your targets for the TMS, or
It is
kind of
it is almost universally prefrontal cortex.
Okay.
We change
Where?
that occasionally if on a Loretta we see that because of traumatic brain injury, the locus is shifted. In which
it's
case
a dorsal side, or
we'll go either way. The only place we avoid is 0102 because the synchrony of vision. Really, you can't touch it. That magnetic field just disrupts it. But everywhere else, the postsynaptic field, when you're doing the 7 to 13 hertz stimulus, it works remarkably well.
Great.